pain on the from in the face. So he doesn't have any pain history of any pain in the face. Okay. Now you can go for the sensory examination for the trigeminal nerve. So we have to check every branches like ophthalmic branches, okay, then maxillary branches and mandibular branches. Okay. So I will give the sensation, okay, general sensation or feeling sensation. Then we have to say, okay, whether we are feeling the sensation or not, and if we are feeling the sensation, whether it is the feeling sensation or general sensation. Okay, please close the eye. Please localize the sensation. Localize it. So in this way, we have checked the all three branches. All right, all three branches.
Corneal.
Conjunctival reflection. Okay.
No.
Please look ahead. Okay. Gaze on the gaze ahead. Okay. So meantime, I will touch his conjunctiva. Okay. And this cotton should be okay. It should be like
Sterilized.
clean. Clean. So many of you student, what do they roll with the hand and make it so dirty and black, and see with the same cotton they use on the conjunctiva. Okay. Be sure the cotton is clean. Okay.
Enggak kan atau? Enggak ada apa? Tidak hard dulu, ali hard dulu. So kah भित्री हाल्नु पर्छ हामीले?
In the conjunctiva means the thin outer layer of the sclera. Okay, so you can go and touch this, and then the blinking of both the eye. Okay, in the case of corneal reflex, okay, don't touch the cotton swab directly to the cornea because it can cause the ulceration. Okay, so be careful about that thing. So what we need to do during the corneal reflex, we need to touch the cornea, clean cotton in the border of the cornea, like this is the black part, okay, cornea, and this is the or conjunctiva, okay, junction between these limbus, okay, we have to touch over there. Okay, so open the eyes and gaze ahead. Okay, this is the corneal reflex. Okay, so like this way you can go and do the jaw reflex. Okay, so I can find the tone of the muscle, I can find the tightness of the muscle on both sides. Okay, on the both sides the tightness is uniform. Okay, open, relax it. Okay, now clean the teeth. Okay, and I can see that both the tightness of the temporalis muscles uniform on both sides. So in this way, we have done the trigeminal examination. We have gone through these sensory fiber examination as well as the motor fiber examination. Okay, and now we move to the facial nerve examination. Okay, so in the facial nerve examination, okay, what we need to do, okay, you have to share the person to subject to stay on the chair comfortably. Okay, then I am going to ask him some of the some questions. Okay, so do you have any problem regarding the salivation? Do you have dry mouth or over salivation? Do you have any over salivation? So do you have dry eye? So do you have over lacrimation? So do you have problem of hyperacusis? All right. So he does not have problem of hyperacusis, no problem with the salivation, no problem with the lacrimation.
Dry eyes.
Okay. So we move to the now move to the motor fiber examination. Okay, so I will command some of, I will tell him some of the, give him some commands. Okay, like please raise the eyebrow. Okay, as you can see here, both sides you can see the furrows. Okay, you can see the furrows. Okay, now please from.
Reside.
Yes, you. From.
Wey. Reside.
Here is the folds, okay? So you can see the folds over the forehead, alright? Okay, and you can see the nasolabial folds as well, okay? And please smile.
Wey.
And there is no deviation, no deviation of the mouth angle, okay? So both the mouth angle is in the same, same plane, okay? And also there is no any stretching, okay? Pulling of the mouth angle to any side, okay? So bilaterally both the mouth angle are intact, alright? So you have to please whistle. Alright, so you can whistle, okay? Please fill the air inside the mouth. In the meantime, I will push the cheek, okay? This is for the oxygenator muscle. The whistling is for whistling is also for the oxygenator muscle. So there is no leaking of the air from his mouth. So his oxygenator muscle is intact. Alright? So okay, now please close the eye. So you can close the eye. Alright? So meantime, so close the eye, and the meantime I will try to open. Okay? You have to try to close it. So I can feel the resistance. Okay, I can feel the resistance he can bring to close the eye, and this is possible due to the good form of that orbicularis oculi muscle. So if there is any weakness in the orbicularis oculi muscle, that won't be possible. We can easily open the eye. Okay, and also we can see that there is no any both side is symmetrical, and there is no any drooping of eyelid. We can see all the folds. Okay, if we tell him to give some expression. Okay, so he no drooping of eyelid, and he can easily close the eye as well. Okay, so no Bell's phenomenon. Okay, so all things are intact. So we have gone. We don't have to perform the sensory examination on the facial nerve, but if the examiner told you should say that from the one anterior to third of the tongue, okay, it carries the sensation from the anterior to third of the tongue. Okay, for that we need to you can test modality like bitter, sour, okay, sweet, all things you should drink and keep on the anterior to third, and you should be able to distinguish it. Alright.
Oh, vestibular problem now.
Okay, so we will ask him. Okay, so do you have any history of vertigo? Are you feeling vertigo? So do you have any history of nystagmus? So you should check whether there is nystagmus right now. He is having nystagmus or not. Okay, so he does not have any history of nystagmus, any history of vertigo. Please stand up. Lean your feet close. Okay, and look ahead and close the eye. So you can stand straight, and there is no swaying of body to any side. Okay, please march your feet, march your feet.
Left, right. Go ahead now. Up, down.
Okay, so you can, there is no any reflection of body or any side. Okay, thank you. Okay, so please sit down. So in this way, his lumbar test negative. Okay, and lumbar test negative. That means after closing the eye, the body will sway to the affected side, but it can be corrected by if we open the eye. So through the visual stimulus, it can be corrected. But in the case of cerebral ataxia, okay, although you open or no matter you open or close the eye, there will be swaying of the body. Okay, that is the cerebral ataxia. But in the case of sensory ataxia, this case, okay, you open the eye, then the visual stimulus can correct that thing. All right. Now hearing test. So hearing test we have to perform to the like we have to perform Renin test and Weber test. Okay, both this require the 256 hertz tuning fork or 512 hertz tuning fork. So we use this tuning fork for the hearing test, that is the Renin test and Weber test. Okay, Renin test and Weber test are done. Okay, okay as a unit. Okay, like if you are performing the Renin test, you should definitely do the Weber test as well. Okay, so okay, I will hit this tuning fork on my hand. Okay, then I will bring that base of the tuning fork on the masted portion. Okay, so okay, now until you hear the vibration, okay, you feel the vibration. Okay, don't raise your hand. If you feel that there is no more vibration, then please raise your hand. Okay, then I will switch that tuning fork over your ear. Okay, and you should tell whether you are listening the sound or not. Okay, all right. So for that, you should close the opposite eye. Oh, sorry, opposite ear. So as I am checking his right ear, you should close the left ear. So are you ready?
त्यो सुन्न बन्द भएपछि चाहिँ हात माथि गर्ने क्या
You listen sound. After switching.
त्यो बोनी कन्डक्सन चाहिँ त्यो स्लो हुन्छ क्या
So this means he is raining positive. Okay, this suggests that his air conduction is better than the longer than the bone conduction. Okay, so sound can be heard through the air conduction and it can be heard from the bone conduction. Okay, because our okay, our internal ear they lie on the bony. Okay, you can see bony capsule. Okay, bony labyrinth. Okay, of the temporal bone. So they are encased in the temporal bone. Okay, that's when if we put here, okay, that vibration will eventually causes the activation of the cochlea, okay, hearing apparatus. Okay, that can causes the activation of okay, these movements of the indolip and eventually where you see the hearing. Okay, the hearing. So it is through the bone conduction and air conduction. Okay, so air conduction is longer than the bone conduction. Normal person. In this way, we have to check okay, Renin in both sides. Okay, and find out whether the air conduction is longer than bone conduction or not. So if
Renin test, Renin.
Like say after moving from the masted person, if we say that he didn't hear the sound, that means he has some conduction defect. So conduction defect can be anything which causes the blockage of the conduction, the sound. Okay, it can be anything. Okay, it can be due to the inflammation or okay, thickening of the tympanic membrane. Okay, otitis media. Okay, and or it can be over wax. Okay, so if anything causes the conduction, okay, blockage of the conduction, that okay brings the conduction defect. So we are moving to Weber test. Okay, so for Weber test, okay, I am taking the tuning fork and I will keep this tuning fork above the head, the center part of the head, okay, on the skull. Okay, now normally there are ears. Okay, so for that you can also bring this base to the forehead as well. Alright, so I am bringing over here. Okay, if I am bringing here, okay, there is the equal distributions of the sound on the both sides. Okay, there is no any lateralization of sound, no any loudness of the sound at any ear. Okay, at any ear in while doing the Weber test. But if he has defect on one ear, like say we're doing the Renin test, okay, Renin was negative, like say if he has conduction defect on this ear, right ear. So if I am doing the Weber test, okay, then there is a more lateralization of the sound on the defected side. Okay, more lateralization of the sound in the defected side. Okay, let's say there can be a deafness, okay, which is the conduction defect. Okay, and there can be a deafness which is related to the nerve. Which is related to the nerve, that is the cochlear nerve. The cochlear nerve is affected, that means it is called the sensorineural deafness. Okay, so in the case of conduction defect, sound will lateralize on the conduction defect side, conduction defect ear. In the case of neuronal deafness, okay, sound, if I do the perform the Weber test, sound will lateralize on the normal ear. Okay, it goes away from the defected ear. What kind of defected? Neuronal defected ear. Okay, so in this way, okay, you can find out about the idea about the conduction defect and the sensory neural. Okay.
Neural.
Neural deafness is probably not detected in this year. If I do the Weber test, okay, then the sound will be more loudly, it will heard on this side, normal side. But in the conduction defect, it will be heard on the conduction defect side. Okay, because air